Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics and emergency medicine, affiliated with Henry Ford Health System, St. Joe, Oakland, and Beaumont. The theme of our Health Talk today is very interesting. The role of calcium scoring in our body, especially for the coronary artery disease. Now, joining us today as my guest speaker is Dr. Larry Baylis, who is a private practitioner, family medicine at Clarkston, and he has done a lot of work and researches with this item that we are going to discuss, and he will highlight our viewers about what is calcium scoring, the anatomy of the coronary arteries, heart, and furthermore. So good morning, Larry. I'm so happy to have you.
Good morning, Dr. Prasad.
And I'm so happy to have you. It took some time for both of us to get connected, and I really thank you for giving us some time. So will you please tell our viewers about your background and everything?
So I'm a family practitioner in Clarkston, Michigan, in private practice, and I've been working in the office since 1991. And I brought this topic up to you, Dr. Prasad, because I think it's pretty important, very important, to try to screen effectively for coronary artery disease. We haven't had anything super effective in preventing or finding heart disease, really until the advent of some more detailed imaging of the heart. And I'm pretty excited to share some of the things that I've learned over many years.
So that's very good, because we want to know, our viewers and including me, want to know what is the role of calcium in the body and how does calcium affect our heart. So I believe you brought a very nice, beautiful illustration of the anatomy of the coronary arteries. Could you kindly show it to our viewers?
Absolutely. So the heart has many arteries, but when we do calcium scoring and when we do things like open heart surgery, coronary artery bypass, stenting, they're really working on four main arteries.
Coronary artery.
Yes,
okay.
Four coronary arteries. The left main, which is called the widowmaker, people hear about that being the widowmaker. It branches off into the left circumflex artery and the left anterior descending artery, and then there's the right coronary artery. Well, we're more interested in this side of the heart with the left main and the left anterior descending left circumflex, because it supplies mostly, unless the right coronary artery is a dominant artery, most of the time it's not, it supplies the left ventricle, where you can see
the posterior part, right?
No, it's the entire...
Anterior and the posterior descending.
The left anterior descending artery supplies the left ventricle, which is a big muscle of the heart. It does all the work when the heart contracts. So it's really important to keep these arteries open, and it's not so easy sometimes to find it preventively. And now we have a way to do that with calcium scoring. The calcium score is a test that is a simple test. It's a CAT scan, much like the one that we talked about years ago with the lung cancer screening.
We did the lung cancer screening with you. I still have that video with me.
And I was super excited, and I adopted it very quickly to find a way to screen for lung cancer with this CAT scan.
Yeah, right.
Well, we do the same thing with the heart and the coronary arteries. Now, this test, all it does is identify the initial test, the calcium score. All it does is identify the amount of calcium in the artery. It's a qualitative test. It does not tell us you have this much blockage in your artery.
Yeah.
All it says is you have calcium. Well, it just so happens that plaque in the arteries most of the time have calcium in it. Now, if you're a young person, you may not have lived long enough to have that plaque develop and progress
Right.
and mature into and have calcium get inside that plaque. So it's not for everybody, but it's a good test, a good screening test for people typically between 50 and 70 is what I say, unless you have risk factors for heart disease. We might do it a little bit earlier. But it tells us, do we have to worry about this person or not?
Okay. So for our viewers to know, this test is done ages 50 to 70 age group.
This is my
50
this is
and
my
plus.
this is my take on how we should screen.
Right,
It's
yeah.
I think that if you wait till 50 years old, chances are any plaque that you have in your artery will start developing calcium in it.
Right.
So finding those people before age 50 can be tricky with this test. So I don't necessarily recommend. I start doing them at 50 years old.
50. And also, Larry, how about people who are immunocompromised, like diabetes, high blood pressure? Those patients, you will do it in earlier age, right?
Correct.
Yeah.
Correct. Because they have risk factors for coronary disease.
Right, risk factors.
Yes. So family history is huge. Smoking is huge.
Smoking.
Yep. And so is diabetes, hypertension, and hypercholesterolemia, high cholesterol. So obesity, but you have to identify risk factors, and then you can. And this is another way to identify risk factors by doing this test.
Right. So you do the test, then you identify the risk factors, and then we correlate it everything with clinically with what our patient has, right?
Correct. So
Right.
many times these patients are asymptomatic, and that's why I went for decades seeing patients go through stress tests and still wondering, they may not have anything imminently dangerous today, but are they at risk for heart disease? And
right,
yes.
yeah.
So you give people sometimes a false sense of security when they pass their stress test or they get their checkup and they think they're all right and they don't do the right thing in terms of aggressive prevention. I think this test will give a little reality check to what's really happening inside their
Right.
body. And I think maybe patients will take it a little bit more seriously when it comes to taking care of themselves.
Yeah, so I did a lot of research studies because I wasn't so aware with this particular, but then it says that 0 to 100 score. You are just
Yes, I want to talk to you about that. So
Yeah.
I will just briefly. They have a scoring, and what it is, it's a unit of measure of how much calcium is in the artery. Okay, 0 to 100 is technically considered normal, but if somebody has a calcium score of 50, what I tell my patients is a snowball starts with a snowflake.
Yeah.
And maybe so 50 is like the snowflake that could balloon. And
Yeah,
that still tells us we still need to be aggressive. But 0 to 100 just basically says, in the next 5 years, you're probably not going to have a problem.
Okay.
100 to 400, you're saying, well, now there's a little bit more.
Something going on.
There's something going on, but let's keep a closer eye on it. Over 400 for my office and my practice, it triggers another test, whether it's a coronary CTA, which is a virtual angiogram, or a stress test. Over 1,000 is considered a meaningful calcium score, meaning, well, you know what, there's probably some significant blockage there. Just so you know, I've had a patient who had a 4,500 score, and they didn't require any intervention. So it's not to alarm people, it's just to raise awareness that, you know what, we need to keep an eye on things. I did want to mention, Dr. Prasad, that there is another test. So this calcium score is a qualitative test. There's another test that is called a CTA, a CAT scan angiogram. It's a semi-quantitative test.
CTA.
CTA.
Because they do a CAT scan,
It's a little, it's still, it's way less invasive than a coronary catheterization angiogram, but it still gives us a semi-quantitative analysis of what are going on inside your arteries. And an example is 1 to 25% blockage, 25 to 50, 50 to 70, over 70% blockage. So it's another layer of prevention strategy.
Yeah. So could you kindly explain to our viewers, how does it work? The procedure for when you do that?
The test?
Yeah.
So
just a simple word.
Yeah, it is. Yes, for the calcium score, it is a very simple test.
Outpatient.
Outpatient. It's a 5-minute test. They don't inject you with. They don't put any IVs in. and in 5 minutes you have a scan and you can get a quick report as to, you know what, we need to go further or we don't need to go further.
Right.
It is a screening test. The CTA is a little bit more of an intense screening test, and of course a heart catheterization is the definitive answer.
Right. So cardiac catheterization is that on the top up towards the diagnosis, but this
Correct.
test is just like a screening test, more
Correct.
than the CT scan, in between, right?
Yes, that's right. That's
Okay.
correct. And it's been very beneficial for my practice, and I
Yeah.
really feel like people. It's not expensive either. I wanted to just mention that.
Yeah, I was going to ask you.
People think about CAT scans
Health
being
insurance.
$500 to $1,000. Insurance does not cover this test.
Right.
But it's about you can get it for approximately $100, and to me, it's well worth it to get a peace of mind. You know, plenty of people between 50 and 70 have calcium scores of 0. So it's a great screening test.
Okay, so that's good. And we talked about the age group, and we talked how you screen this patient. So what will be the 1-minute keynote advice to you for our viewers from today's your health talk?
Well, the most important thing is, number one, take care of yourself. You know, do the right thing.
Back to normal.
Keep your weight under control.
Right.
Keep your sugar under control.
Yeah.
Keep an eye on your blood pressure. Don't smoke. Quit smoking if you do. And lastly, I'm just going to mention diet real briefly, is eat cleanly. Don't trust our food supply. It's poison in America.
You know, that is...
Whole foods, organic when you can, no boxed foods, no packaged foods. Eat right, get some exercise, and do some strength training, and I'll tell you what, you're going to go, it'll take you a long way.
Right. So that's very good, Larry. You talked a lot about this whole thing. The only one thing is, you know, because we are unable to discuss further about the procedure. So bottom line is, for our viewers, after watching my videos that Dr. Larry has come up with, and so self-explanatory, that bottom line is, like he said, is stay healthy. Exercise and yoga. There's a role of yoga also, right?
I agree.
Right.
All forms of exercise, correct.
Right, yeah. So I'd like to thank our viewers for watching us today on Health Talk with Dr. Larry Baylis. And anybody, if has any questions, they can always, if they have any question, they can call the TV station, and we will get hold of our guest speaker to answer. So I'd like to thank our producers for helping me prepare this video. I'd like to thank our viewers for watching it today. And unless I see you guys again, have a wonderful fall and upcoming winter. Thank you again.